faces, worn out places, worn out faces, bright and early for their daily races, going nowhere, going nowhere. Their tears are filling up their glasses, no expression, no expression. Hide my head, I wanna drown my sorrow. No tomorrow, no tomorrow. And I find it kinda funny, I find it kinda sad. The dreams in which I'm dying are the best I've ever had. I find it hard to tell you, I find it hard to take. When people run in circles, it's a very, very mad world. Mad world.
And I remember at one point years ago thinking, so be it. I mean, this is what I really want. This is the one thing that I want so bad. I just want to be thin. So if it takes dying to get there, so be it. At least I'll get there.
When you look at the definition of anorexia or nervosis, that an individual has a weight that is below 85% of ideal body weight, but that's really not the only thing that we see. We have to look at some of the underlying psychological reasons why somebody may turn to anorexia or bulimia. Very often, as you'll see in the literature, it's a desire to have some control in one's life. So when one feels that things in their life have gotten out of control, what is the one thing that they can control more on a personal level? They can control the number on the scale. They can control their weight. They can control what goes in and out of their mouth as well. Sometimes an eating disorder is a desire for attention. It's a coping skill. It's a way to deal with stress. It's a way to deal with some family issues. If you look at a lot of the common characteristics of girls or women or men or boys who develop eating disorders, it's they have low self-esteem, they're perfectionists, they're very high achievers as well. So it does really, in essence, become a way to deal with stress. Now, in bulimia, too, another misperception is that an individual binges and purges, as you mentioned, to become thin. And bulimia at times is very often much easier to conceal. You may not notice somebody who's bulimic walking down the street because those individuals tend to be normal weight or even slightly above normal weight, so it is a lot easier to conceal that.
Right.
Individuals with bulimia tend to use the food, hence the binging portion of the bulimia diagnosis, to stuff in their emotions, hence the binge. But what happens after that is because they've consumed, a large amount of food within a 2-hour discrete period of time than one normally would consume, they then at that point feel guilty, hence the purging piece. So the metaphor is that the purging serves as a way to rid themselves of all those feelings they've stuffed, the feelings of guilt. Purging also does not come in the forms of vomiting. Purging could be using laxatives, enemas, ipecac, excessive exercise, and then even fasting for a certain period of time after a binge.
When my daughter was going through her eating disorder, what I saw was, I saw the sparkle leave her eyes. There was no life in her. And it was like watching her wither away to the point where she was dying. She was dying inside, she was dying outside, and the hardest part was the fact that she couldn't see it. And when we would show her pictures, she thought she looked great. She thought she looked healthy. It wasn't until afterwards, when she was in recovery, that she looked back at those pictures and saw how ill she was. And then talking with her, she felt at the time that it was the worst. She felt like she could smell death. And you could see it on her. By the time she got into rehab for it and treatment for her eating disorder, it was to the point where they had to put her on a heart monitor and they had to do EKGs every morning to get her heart rate and her blood pressures and all her vitals, because they can't get it the regular way. Had we not gotten her help when we did, she probably would have died within a month, if not sooner, of getting her in the hospital and getting her help. That's how ill she was. She didn't see it.
Mad world, mad world, enlarging your
What you see with the women at Renfrew and the women who are suffering with a true eating disorder is that they are committing a form of slow suicide.
Any restricting?
Yeah, it's usually restricting. I try to keep my calories under 200 a day. I see problem areas.
The physical complications can affect their treatment. If somebody is medically compromised, we are not able to treat them at the intensive outpatient level of care or the outpatient level of care. So some of the common physical complications that we're seeing are dehydration, heart arrhythmias, things along those lines. But in order for them to become a part of our intensive outpatient program, they have to have lab work that's been completed in the last 30 days, as well as an EKG, just to make sure that they're medically stable, because that is one of the questions that the insurance company will ask us. Continuing with the eating disorder puts them at risk for physical complications, emotional complications, and possibly even death.
How aware are the patients that the physical complications are worse than what they're doing to themselves at that moment?
They're very aware of the physical complications. We definitely educate them on current physical complications that they might be experiencing, as well as the potential for further physical complications if they are to continue to engage in the eating disorder.